My name is Nambi Cooper. I'm the director for ONEgeneration Senior Enrichment Center here in Reseda, California. We're so grateful to provide this presentation today with City of Hope, who was ranked the nation's best hospitals in cancer by U.S. News and World Report for over a decade. So today we have Dr. Benjamin Leach, who is of medical oncology and hematology with City of Hope in Mission Hills, California. Dr. Leach, it is a pleasure to have you here with us today. Thank you so much for joining us. We're eager to hear about COVID-19 and cancer. So please feel free to start your presentation.
Thank you so much. I appreciate that introduction, and I'm really happy to be here, be able to talk to you guys, even though it's remotely. So we'll just dive right into it, and then if people have questions, we can, I don't know if people know how to do the hand raising thing on here. We can do that, or we can just ask at the end. Either way is fine. We can kind of just see how it goes. Let me see. Okay, so I just wanted to give a brief introduction about myself and where I'm coming from. So I work for City of Hope. I'm a medical oncologist and a hematologist, which means I'm a cancer and blood doctor. And City of Hope, of course, is a large organization that specializes in taking care of patients with cancer. It's been around many years, since early 1900s. And it's primarily based out of Duarte, which is the main City of Hope campus. You may have been there, seen it, or heard about it before. Very large campus. But I work out of the practice that's actually close to the senior center here in Mission Hills. I'm actually located right in front of Providence Holy Cross, the hospital there. I put a picture here on the bottom. You may have driven by when you're on Rinaldi, going by Providence Holy Cross and seen our signs, but that's where our office is. That's where I am right now. That's where we see patients. That's where we treat cancer. We do chemotherapy here. We have a radiation center here. And then of course we're connected as well to the hospital, to Holy Cross. So we have a sort of agreement with them, and we see patients there. And then we're closely linked with the rest of the City of Hope group. City of Hope has a large amount of different practice locations throughout Southern California, and this is one of them. So that's sort of where I'm coming from, just so you can get a sense of who you're listening to. So I wanted to just start with some basic stuff before we dive in too deeply, because a lot of this stuff is pretty complicated and you can sort of get wrapped up in the details. But first, I wanted to just start with talking about what is cancer and some of the important points about cancer. Cancer at its most basic form is just uncontrolled, abnormal growth of cells in your body. And that can originate, in theory, anywhere. So there's a picture here you can see on the bottom. Are you guys able to see my mouse move around? Yeah, okay. So you can see on the bottom here it says primary cancer, and it's showing a picture of a person's colon. So in this situation, this is a person developing a colon cancer, and then they're showing how it can spread to other parts of the body. And that's the problem with cancer. One of the main problems is that it grows in a specific area and then spreads to other parts of the body. That's called a metastasis. And that's what can cause a lot of the problems and a lot of the difficulties with cancer. So if the cancer spreads to the lungs, for example, you could develop difficulty breathing. So that's where cancer becomes a big problem. And it spreads through various methods, one of which is through your blood, the other is through your lymph system. But the idea is that we want to, as cancer doctors and physicians that are taking care of people with cancer, we want to prevent it from spreading. We want to prevent it from happening in the beginning. And we want to, hopefully, if it's already spread, we want to shrink it down or keep it under control. So that's sort of the general overview about cancer itself. And one of the questions, I think that most of my patients often ask is, well, what can I do to protect myself from cancer? Is there anything that I can do? And I think some of these things, this is from one of the National Cancer Institute's just cancer prevention tips, which I think are really good. It sort of tells succinctly the most important things, but some of these things are we all know. Smoking, for example, is linked with lung cancer, and so quitting smoking is important. A number of things that we also, I think, all go through are screening tests. So one they mention here is colon polyps. So having a colonoscopy and having the polyps removed, that's important because those polyps could, in theory, down the line, turn into a cancer. And so there's all these various different things we can do. I mentioned some of the lifestyle choices like quitting smoking, avoiding alcohol, of course, maintaining a healthy weight, and diet and exercise are important. The screening tests, as I mentioned, other screening tests would be things like a mammogram or a pap smear. And then there's some other things that are important to know. There's some infections that are associated with cancer, so reducing the risk of being exposed to that, things like hepatitis, HIV. It's important to be aware of that. And if you do have a risk factor for one of those infections, having that treated and having it under control would help to mitigate your risk of developing cancer. And then they mentioned surgery here. So for some people who are at a high risk for cancer, so for example, people like Angelina Jolie, you may have heard about in the news, had a special mutation in her DNA that predisposed her to developing breast cancer. And so she prophylactically had her breast removed. And that's a thing that's now done quite commonly to help minimize the risk of someone developing cancer for somebody at a higher risk than normal. And then, of course, there's also some medications that can reduce cancer risk. And this is a little bit more of a controversial area, although we think that probably there's some hormone medicines and some medicine, even baby aspirin seems to reduce the risk of colon cancer. So there's some risk protection stuff there. But all these things come together to help protect people from cancer. And part of the reason I bring that up is because thinking about disease nowadays, one of the main things is how can we protect ourselves from something? How can we prevent it? So I want to switch gears and talk about the COVID pandemic now and just talk a little bit about the basic stuff that's going on with it, and then talk about how we can prevent developing COVID-19. So I think everyone knows at this point that COVID-19 is a respiratory virus. It's caused by a type of virus called a coronavirus. And COVID-19 is sort of like the syndrome or respiratory illness that you develop when you're infected with this virus. Coronaviruses have been around for a long time. This is just a new strain that's particularly scary, and it's particularly contagious, and can be particularly deadly, unfortunately. The virus, began, we think now, there's a lot of thought about when this really started, but we think probably in late 2019. And the thought is that it may have originated somewhere in China, but there's really a lot of research looking at this. And of course, now it's a pandemic and is spread everywhere across the world. And the virus is, for most people, not a big deal. And, it causes cold symptoms, essentially, or for many people, they're totally asymptomatic. The problem is that for certain groups of people, the virus can be a very scary thing. And, mostly that's why you'll see, and we'll talk about this in a little bit, that we're targeting certain groups to get vaccinated first, because those are the people at highest risk for having complications. So I just put on here some of the symptoms that people see with the COVID-19. And like I said, it's pretty much cold or flu type symptoms. You know, fever is a big one, coughing is a big one, sore throat. One they didn't show here that's important to point out is loss of taste or smell is sort of a symptom that's very unique to this virus. You don't typically get that with other infections. So that's something to be aware of. If you develop those symptoms, you really want to be in touch with your doctor about it. If you're living in a situation with other people, you want to make sure to try and quarantine, and it's important to be tested. There's a lot of places that you can be tested now. I'm not sure at the senior center what the setup is, but you know, in the community, there's many different locations where you can go for testing. And we can maybe talk at the end about what the setup is there for you guys. And then I put down here on the bottom, if you can see this, the rates of hospitalization increase with age. And this is something I just wanted to really draw your attention to, is that this virus seems to be much worse for people as they get older. Fortunately, even for older people, many of them are okay, but your risk of being hospitalized and being seriously ill or even dying becomes much higher as you get higher in age. And in particular, for those greater than 65, it's quite a risk. And when you sort of put in not only age, but also other medical problems, it starts to become more and more, you know, the risk builds higher and higher. And so that's why now, you know, in LA County, at least, they've rolled out the vaccine for people 65 and up. But we're going to talk about that in a little bit, how that's sort of going. So I just wanted to touch base on some of the stuff that I think we all know, we all are aware of, but in the same vein as how do you protect yourself from cancer, there's a question as how do you protect yourself from a virus? It's a very different set of behaviors because the virus is transmitted between people. You know, cancer is something that is not contagious. You can't get it from another person. So a virus you can. And so mostly the recommendations are directed at things like social distancing, which I'm sure everyone's heard, and washing your hands, 6 feet apart, cleaning, all these sorts of things. There's been all these regulations about going to restaurants and that sort of thing. So that's been how this is being recommended, that you protect yourself. And then here on the side here, lists some points that I sort of mentioned earlier about those people that are at higher risk. So the first one they say right away is if you're older, meaning greater than 65, that this is a real risk for you and you really, really do need to be cautious. If you throw in any of the following, and it lists there, cancer is one of them, but also a lot of people we're seeing in the hospital have chronic kidney problems, for example. If you're overweight or obese, this could be a real risk factor for developing a more serious infection. So these people really, you know, really need to be careful. And as soon as you can get vaccinated, I would recommend it. The vaccination is being rolled out. I have been vaccinated. My wife was vaccinated. She's a nurse. I can tell you that we experienced some side effects from it, and it was a little more serious than we had before from the flu shot, for example, but it only lasted for a couple days. I had some body aches, my wife was a little bit tired, and then the symptoms resolved completely. A number of my colleagues here, the other doctors and nurses, did not experience any symptoms from it. But I just want to, you know, point that out, that some of the stuff you may have been hearing in the news, or there's a lot of hearsay about people having serious reactions, and the truth is very unlikely that you have a reaction or something really negative consequence from the vaccination that where you become more ill. So I really recommend that people get this vaccine. It's been found in the clinical trials to be more than 90% effective, almost 95% effective at preventing COVID-19. And it's given in 2 doses. Right now we have authorized two vaccinations in the United States. There's the Pfizer vaccination and the Moderna vaccination. Those are the companies making these vaccinations. And they're given one, and then the next is given roughly 3 to 4 weeks later. What I think has some people concerned and worried about it is it's a new type of vaccination. So unlike the other vaccines that we get when we're little kids, or the flu vaccine, this is a totally different type of scientific method for delivering a vaccine. And it's a little bit complicated, but I put sort of a picture here on the bottom. Essentially, the vaccine is an injection of a code. And that code, they use this term mRNA. And it's a code that the body can read to create little parts of the virus. So those little parts are the spike protein. So you're injected with a little code. Your body uses that code to create little parts of the virus's shell. And then our immune system sees those virus shell parts and creates immunity. It basically creates a response to those little shell parts that are made. And so that's how it works. It's that simple. People are worried that, well, it's a code. Does that become part of my DNA? It doesn't become part of your DNA. It's not possible for it to do that. It's not a piece of DNA. It's something different. It's a piece of RNA. Other people are worried about long-term consequences. These are vaccines that have been studied for many, many years. It's just that now they're finally being sort of expeditiously rolled out for everyone because of the pandemic. But this has been something that companies have been studying for a long time. Moderna has been involved with this in a long time. These have been under development. They've been tested in animals and the laboratory for many years, and then recently multiple times in humans. And at this point, millions and millions of people have now been vaccinated. I just will touch on this because this is the stuff that comes up in the news that, oh, there was a doctor in Florida who got the vaccine and died. That's true, that somebody in Florida, a physician there, was vaccinated and then subsequently developed some medical problem and died. Just would point out that if you are vaccinating millions and millions of people, by sheer coincidence alone, some people may develop a problem within the weeks after being vaccinated. And whether that's correlated with the vaccine or not, it's impossible to know. I would just say that, look, that's one person out of many millions. We're really not hearing of other reactions like this. And so I think it's totally safe. I think it's important that we all get it. I can tell you that the news is not exaggerating how serious this is. I make rounds in the hospital here every day, and it's devastating how this is impacting people. A lot of very, very sick people. And, we don't have great treatments for this is the other issue, is that if you become critically sick with COVID-19, the treatments are not very effective that we have available for you in the hospital, unfortunately. We're trying to develop, scientists are looking at what can be done for people that are critically ill from this. But at this point, the best treatment is prevention. So that's where the vaccine comes in. If you are, so we can talk about this a little more afterwards, because I'm curious how it's being coordinated there, if you guys have anything set up. But I can tell you, when I'm talking to my patients, we are recommending patients go to the LA County website. I put it there on the bottom, vaccinatelacounty.com. Sometimes it works, sometimes it doesn't. But there's also, if you just type in Vaccinate LA County to Google, you can go to the website, and that's where you sign up. You sign up online, and they'll offer you, if you meet the tier, which is 65 and up right now, then you can select your date and time and that sort of thing. So that's the way that's being done. And this is just a picture of what the vaccine site looks like. You just sort of go in here and it'll tell you this is the actively vaccinating phase. Are you in this phase? Here's phase 1B. Okay, resident 65, book an appointment. You click on this and sort of follow the links. And then I think phase 1, tier 2, these other phases are going to be coming soon, where we'll be doing more vaccination, hopefully moving down as far as age. Now, one of the things that we get a lot of questions about, and I thought would be nice to talk about, was how do these two diseases intersect, and how do we take care of people who have cancer in the era of COVID-19 pandemic, especially knowing that people with cancer are potentially more susceptible to COVID-19 and potentially more susceptible to developing a more serious infection. First, this virus everyone's at risk. So whether you have cancer or not, you want to be careful. And I again listed some risk factors here, but I think it's just important to say, just because you don't have these risk factors doesn't mean that you're okay and everything's good, because remember, you could get sick and pass it on to somebody that does have these risk factors. So all of us being cautious together is really important. You may not be preventing a problem for yourself, but what if you're helping somebody else, an elderly person, by preventing them from getting sick? That would be a really nice, important thing to do. So just to touch on the cancer care part, one of the main problems that one of my patients ask about is especially patients who are on cancer treatment. So, the treatments that we give for cancer, like chemotherapy or radiation, can be really, quite intense. And some of the collateral damage from these medicines and treatments is to the patient's immune system. And so there's a feeling that the immune system is perhaps weakened, and that may then predispose people to an increased risk for severe illness from the infection. We are being very cautious about that, and as a result, we're sort of sticking to a lot of social distancing here in the office, and I think that's the case with most physicians. We are practicing a lot of telemedicine. There's a lot of things that have been introduced. So patients should still be following up with their doctor. We still want you to be seen, whether that's perhaps going to be over the phone or through video. It's not a good idea to not be seen, right? Because something, if we miss something and something bad develops, and then the cat's out of the bag. So it's good to keep up. And we are recommending actually that patients get vaccinated who have cancer, and including patients that are on treatment. There are some subtle recommendations there from some of the oncology guideline oncology bodies that put out guidelines. So those are very specific for people that are having like a bone marrow transplant. But by and large, most patients who have cancer or on cancer treatment should still get the COVID-19 vaccine as soon as they can, as long as you meet that age criteria. And I think what we're going to see is, as the time goes by, that people with these underlying risk factors, other diseases, will be hopefully pushed towards the top of the list as far as vaccination goes. One of the questions sometimes is, well, should we postpone my cancer treatment, with this situation? And it's a difficult question to answer. We don't know when this is going to end. We're rolling out the vaccine. We expect things to improve, but we're also seeing that there's mutated strains that have been identified already here in this country that were seen originally in places like the UK or South Africa, and now those strains have been identified here. It's thought that the vaccine is protective, but it hasn't been studied as much as we'd like. People are looking at that now. So we don't know, in other words, when the pandemic's going to end. So delaying treatment of a life-threatening cancer is probably not a good idea. Now, there are some very indolent cancers, very slow-growing cancers, things like prostate cancer, for example, if you have a low-grade prostate cancer, that could be very slow growing. Perhaps you wouldn't need to be on treatment right now, and you could just sort of continue isolating and staying away from people and then revisit getting treatment later. So it's a discussion that you really have to have with your oncologist. The same is true for anything, though. I listed here not only your doctor, but think about your dentist, right? So is it a good time to get your teeth cleaned? Maybe not, but it depends on the situation and the person. If somebody's having a lot of dental problems or recurrent issues, perhaps you need to. So that's a discussion that you really have to have with your healthcare provider. And this is one of the challenges nowadays, sort of determining what needs to be treated and what can be continued as far as monitoring. This slide is just here to show you what you can expect at my office, but I think, in talking to other physicians, this is a practice that's become universal. So one of the biggest things that's changed since the COVID pandemic is telehealth has taken off, and it's really something I think that was in the works already, setting up for patients to have visits either through a system like this, how we're having now, like on a meeting system where you have a video, or through the phone. And it's something that's made sense for a long time. And because of the pandemic, that's been expedited, that process. For City of Hope, we have a whole system set up called Hope Virtual, where we can see patients through the computer, and many of my colleagues are doing that. Obviously, it's nice because it's helps with minimizing social interaction and transmitting the virus, but it's also convenient for people. You're able to see people further away. Patients who are not feeling well can maybe still do a doctor's visit from home. So I think it's something that's going to really change how medicine's practiced in a good way. If you do come to the office, you can expect that we're going to have all these different precautions in place. And this is, again, true, I think, with any doctor's office, that there's a lot of social distancing. In the waiting rooms, everyone is wearing a mask. I'm not wearing one now only because I'm by myself in a room, but normally we're wearing masks. Got mine right here. And goggles as well. We're checking people's temperature, screening for symptoms, and no visitors are allowed. That's the other thing that's kind of a bummer, and that's true in the hospital too, that visitors are not allowed, and it can be really hard, obviously, for people that are hospitalized. So I'm hoping that some of those things can be relaxed at some time soon, but for now we're still, within this time frame of having a lot of transmission and infections, and so those are the sort of things you can expect. The other thing I think that maybe people aren't totally aware of is a tremendous strain on the healthcare system, and you end up having many healthcare workers and hospital workers, clinic workers, calling out sick, who are sick or who have to take care of their family. And so a lot of places, including this office at times, are running on sort of like a skeleton staff. And that can be frustrating because then things end up taking longer. There's a big limit. I know a big bottleneck through the hospital with scheduling scans, procedures. Right now, for example, at Holy Cross, the surgery situation is really challenging. So not a lot of surgeries are going on like they were before, and they're having to prioritize, what surgeries can take place. Obviously, emergency surgery is the most important, but then also, what about cancer surgery? And some of those things are having to be slightly delayed, and so that's a challenge. It's something that hopefully is not going to persist much longer, but something to be aware of, that the healthcare system is under tremendous strain. That's most of the stuff I wanted to talk about. I wanted to leave some time to see if people had questions about the virus, questions about cancer care, questions about anything really. So I'll stop there. Appreciate your guys' time and see if anybody has any questions. And that's okay if you don't. That's okay if you don't. I appreciate you guys having me here.
Dr. Leach, I had a question.
Sure.
Can you hear me?
Yes.
Let's say if you had like a patient that was had immune deficiency, and what if the antibodies from the vaccine, is that still like a conversation that you have between the doctor and the patient of whether it's the right time for them to get it, depending on where they are probably in their treatment, if they say they do have cancer or just or any kind of immune deficiency? Is it still a conversation that you need to have with your doctor before you get it, or should you just go ahead and get it?
Yes.
Regardless, because you need it.
Yeah, I think you definitely want to talk to your doctor about it, because there are actually a few immune deficiency situations where probably putting off getting it makes sense. So for example, people that have recently had a bone marrow transplant, there's really not a recommendation for them to get the vaccine right now. And that's because they just won't generate a response. It would be a wasted vaccine for them. And that's because they have essentially no immune system. So you do have to have somewhat of an immune system to generate an immune response. Now, there's other situations that are less extreme immune deficiencies. So there's a number of medications that we give for things like lymphoma, and many of those probably will make it so that perhaps your immune response isn't as strong if you were to get the vaccine. But still, we're recommending that you do the vaccine because it would be worth, even if it helps to make it so when you get the infection, it's less severe. Because that's actually one of the points about the flu vaccine, for example. Sometimes you hear from people that, oh, I got the flu vaccine, but I still got the flu. What was that all about? Well, it's two things. One is the flu vaccine is created each year and targeted to hopefully prevent the flu that's circulating that year, but it's not 100% perfect. But the other thing is the flu vaccine can help to make it so that you're not quite as sick if you do get the flu. And the feeling is that this vaccine for coronavirus is probably similar, that if you do in fact get sick, despite having the vaccine, you probably won't get as sick as you could have otherwise. So, how that plays out for people that are slightly immune deficient, we don't 100% know. It's sort of theoretical. There's not really a downside. The downside is you would have a wasted vaccine. Unlike other potential vaccines that are considered live vaccines, so there's some vaccines that are sort of like a live organism that's given, where you could in theory get the actual virus from that. This is not that. This is a code, a little piece of code that's given to you. You cannot get the infection from this vaccine at all.
Thank you. Thank you for answering that for me.
Any other questions at all? Well, if not, this is my information here, my phone number. I'm happy to come and talk anytime. Hopefully when the virus situation improves, I'm hoping that we can do some in-person meetings, that kind of thing. I'm always available for any educational, teaching type opportunities if you guys are interested in that.
Definitely. Thank you so much, Doctor. I really appreciate you for coming. Thank you, everyone, for coming today. We really appreciate you.
Sure. Thank you so much.
Thank you, everyone.
Take care.
Take care. Bye-bye.